a dining room table.
Oh yes, I did tell the woman standing there with a president looking like Hitler, who compares us to the Nazis, that I thought she was out of her mind. I did put her down. If you want to be on her side, okay. But you say I'm not putting anyone down, and we're here discussing this. I object, frankly, the people who are putting people down are the people who boo and laugh derisively rather than make rational arguments. That's putting people down.
That's everybody that's here.
It's thinking that we're here.
All in favor of the next question, say aye.
I want to respond, ma'am. I'm here tonight. I'm not accountable for what's said all over the media. I am not putting anybody down. I think, in fact, the denigration has been on the other side of people who have laughed and hooted and have rather than rational. So it seems to me you're objecting to something that's not happening here.
Who do you work for?
Congressman, I first want to address something you've been saying online about the Iraq War. Article 1 of the Constitution gives Congress the ability to declare war. It does not give the federal government the power to enforce health care upon its citizens as you would like. Now, the next...
Can I respond to that?
Okay. You want to respond?
Yes. No, I disagree with you on the Constitution. First of all, George Bush didn't No, excuse me. When people ask a question and I respond, I don't understand why I'm not supposed to respond. The war in Iraq, like other wars, unfortunately, was initiated by a president who said, it's not up to Congress, it's up to me. I was trying to reinforce the view that, yes, Congress should have more of a say in when we go to war. Well, this Congress didn't vote to go to war, and I voted against it. But the fact is, well, he brought it up. The fact is that the war in Iraq was initiated by President Bush, as previous wars were by other presidents since World War II, without a declaration of war, and I think that is a mistake. So I think Congress should have more role. As to health care, no, I think you apparently think Medicare is unconstitutional. I do not. You say there's no constitutional mandate to do this. I'm glad that Medicare was voted. I've only been under 4 years. It did a lot of good before me. But you and I differ if you think Medicare is unconstitutional. And you think it's unconstitutional? Do you think Medicare is unconstitutional, sir?
I think Medicare needs to be...
Do you think it's unconstitutional? You said that the Constitution doesn't give us the authority to do it, but Medicare was done, and do you think Medicare is unconstitutional?
I think that Medicare needs to be reformed.
But you won't tell me whether you think it's unconstitutional, which you said you did.
I'm not a constitutional lawyer, not yet.
Then why'd you start off arguing the Constitution?
I have an actual question for you now. What sort of empirical data can you give us, not just rhetoric as you have, as the President's been giving us? What is your data that healthcare reform will save Americans money, will not put private companies out of business, and will help us fix the economic crisis that we're in right now? Because all I'm hearing is talking and no data. What is your...
Well, I don't argue that it's going to help fix the economic crisis we're in right now, so I'm not going to give you data. There are other things that we're working on to try to do that. Secondly, for example, stopping foreclosures for people who are unemployed, I think would help us avoid further deterioration in the economy by holding up house prices. But so I don't make that claim. The only claim I would make of the three you asked for defense of was the one that says it won't put health care, it won't put private insurance out of business, and the answer is Medicare. We have had Medicare, a much more extensive government-run program than anything contemplated in this bill since 1965, and you're the one who said that we had no constitutional authority. I think that's wrong, and I cite Medicare. But Medicare has been, the private insurance companies have thrived with Medicare. Medicare has, in fact, I think, probably been too generous to them. So my empirical data is history and facts. Medicare has not put private insurance companies out of business.
Not yet.
Well, after 44 years, I don't think it's... Yes, it is for people over 65, essentially. Well, no health care is Medicare. No, Medicare is meant after 65. Most people on Medicare don't work.
My name is Robert Darrell. Thank you for coming tonight. I want to actually thank the Democrats not for me for throwing the event, and so many of my fellow South Coast residents, Dartmouth residents, for attending. It's great that we have the opportunity for you to come down to express our democratic rights in this Republican form of government, have you address our questions, and I really appreciate that. Now, let me do say, in the interest of full disclosure, that yes, I am the Republican State Committee man for the Central Montana District and the regional chair. And to say that I did vote for President Bush twice, quite proudly. But I'm not here because I'm here. It's really a personal concern. I haven't read the health bill. I'll admit that. I trust that you have read substantially. And my personal question.
Don't wait for the movie, it's not coming.
But I'm not here to throw a gotcha question at you. Matter of fact, you and I will agree. I think that some of the things that have gone on, I agree with. I think the pictures of our president portrayed as Hitler is deplorable, and I will agree with you on that.
Thank you.
My personal question is simply this. I'm 31 years old. I'm a child of hardworking middle-class parents. My father is on Medicare for medically retired due to an accident. Let me just say this. Here's my concern. I know Brady said that we don't want to be afraid. I have a fear of healthcare reform. I agree. I think we all agree that healthcare needs to be reformed. It's not a perfect system. It doesn't work the way it should. How to fix it is the question. And my fear, and my personal concern is simply this. As I said, I'm 31 years old. From age 4 to 16, I had approximately 25 surgeries. I don't talk a lot about it. I had 25 surgeries, not even life-threatening. About 20 of them for my hearing. I think hearing is an important quality of life.
Well, sometimes I value it more than others.
I'll be brief on the tax shares. But I was born substantially deaf, and had most of those surgeries so that I could hear. My fear is a simple question of rationing under reform. And again, I have read the bill. I trust you have. Could you please address the extent of rationing under the proposed reforms? And because what I fear is, my parents have private health insurance. My father, truck driver for all those years, helped me those surgeries so I can hear today. I'm afraid that my children or grandchildren will be in a system where, at 31, maybe they're still waiting for that surgery so that they can hear. And that's my concern with legislation.
Yeah, I agree. It's a legitimate concern. The answer is nothing in this bill would in any way do that. As a matter of fact, what it will do is the opposite. To the extent that there's a government role here with private insurance, it will be to urge them to do more. And in fact, there has already been an agreement between the health insurance industry and the Obama administration and the Senate Democrats. Some of my House colleagues were a little annoyed they were left out. The health insurance industry has dropped some of the restrictions. Pre-existing conditions will not be a cause for exclusion. There's an annual cap on co-pays that, now, there will be plans that could be outside that, but to get certain of the benefits, you will have to do that. So the answer is there is nothing in this bill that will do rationing. The one argument that was made was by the 89-year-old woman before, who looks great. She's obviously doing good with healthcare so far. And the answer is we will, and this bill does try to do this, expand the supply. Now again, I want to stress, it's not that these people who are uncovered aren't getting health care. They're getting it in a very inefficient, slapdash way. They're getting it in emergency rooms. What that generally means is they get less of it at first, and then they need a lot of it because they haven't gotten the kind of preventive care beforehand. But there are other things in this bill to try and expand medical education, try and do some financial incentives for people to become primary care doctors because we don't have enough. So nothing in this bill calls for rationing. And I will say this, as you look at rationing, in my experience, more people complain to my office that they were denied health care they wanted from private insurance companies than from Medicare. More, that is, to the extent that there have been denials of service, they've come from the private insurance companies. I think under this plan, that will happen less.